Hi, I'm Dr. Laura, and I want to talk about the cerebellum, a structure in the back of the brain, and it's responsible for the rate, rhythm, and force of behavior. At least traditionally, that's what we've talked about the cerebellum in the context of. So it's the part of the brain that tells my hand exactly how much force to use to pick up my telephone versus my ink pen. It's an automatic system where it adjusts. And Schmahmann has a concept, he's an author, talks about something cerebellar cognitive affective syndrome. And why that's relevant to people who don't even have that syndrome, it's because he extends this concept of the cerebellum being a supervisor of behavior, but he extends it also to affect or emotion. He'll talk about how cerebellum regulates the rate, rhythm, and force of emotion. So if someone has a cerebellar dysfunction, we're talking about behavior again, there might be a dysregulation in how somebody picks up something. They might apply too much force, or it might be kind of a dysregulated or inconsistent action. Too much force or not enough force or irregular force. That's the cerebellum not acting properly. Now, if we're talking about emotion, the cerebellum, again, also plays a theoretical role in emotions. You can apply too much emotion to a situation where you, air quotes, overreact, giving a situation more emotion than it needs. We also talk about the cerebellar dysregulation in people who have, quote, hypersensitivities to sensory input. So the people who have irritations or over irritations with the tag in the back of the shirt. I have patients who won't wear blue jeans because of the texture's too heavy or too irritating. I have people who can't wear certain clothes with big seams in them. The seams cause a lot of irritation. So there's textural sensitivities to noises. So meaning that there's a expected level of irritation. For example, back to the tag in the shirt, there's an expected level of irritation, but some people are dysregulated where they give too much force to their reaction. Also, in the same vein, I guess, there's a certain irritation someone would have when a fire alarm goes off for no reason. There's an irritation from the loud noise, and you can kind of feel that to a degree, but there's certain people who overfeel it, who feel it as if their life is being threatened, or just the reaction is more than one would expect for that kind of sound. And so again, the cerebellum's involved in that, applying too much force to the reaction. And again, if we're talking about emotion, there might be a situation, hey, come up for dinner, put your game away, put your computer away, come to the table for dinner. And then some people might have an overreaction. They can't flex, they can't adjust to the switching to the new situation or the new demands on them, and they have a, quote, overreaction or maybe even an emotional meltdown. Especially if we're talking about younger children, they may throw themselves on the floor and react as if it's the end of the world, the sky is falling, when merely you're asked to leave your activity for half an hour to go have dinner and whatever else after that. So again, cerebellum's involved in the rate, rhythm, and force of behavior, but it's also extended to the rate, rhythm, and force of emotion, and that's according to some ideas expanded by Dr. Schmahmann. There's also another author, Dr. Ito, who further extends these concepts into the rate, rhythm, and force of cognition. So he talks about how the cerebellum is looped into the frontal cortex, the dorsolateral frontal cortex. So it regulates planning, it regulates your thought, it regulates language. So not just speech, which when we were talking about behavior a minute ago, cerebellum certainly regulates the prosody and the rate of your speech. But Ito is also talking about how cerebellum regulates the thinking and regulates how you plan for what you need to say, how you put steps in order to execute doing things, but also execute saying things or execute thinking things. So you're trying to solve a problem and you have to put your thoughts in order, or the steps of the problem into an order in order to execute it. And again, the cerebellum plays a role in that, so we're talking about the prefrontal cortex looped to the cerebellum in that situation. The cerebellum, according to Ito, in other models, people who do this modeling, the cerebellum's also looped into the orbital frontal cortex, and that's a brain region responsible for affect. So again, we're talking about Schmahmann's idea. So cerebellum loops into the emotional system, regulating emotion, and then that orbital frontal cortex is also responsible for motivation. So again, cerebellum's involved in motivation. Are you too motivated? Are you under-motivated? And cerebellum plays a role in that. And also cerebellum gets looped into the temporal parietal lobes. And so the temporal lobes, parietal lobes have to do with context of situation, the perceptual inputs, the sensory inputs, and taking that sensory information and turning it into an image for the brain to deal with. So parietal lobe, again, is spatial relationships, context, and these are these parietal regions here that take the outside world, turn it into a shape, put the sensory material into a context, and develops an image that's projected and used by the frontal lobes. So a lot of looping essentially going on, that the cerebellum's looped into the temporoparietal lobes, looped into the frontal cortex, looped in the orbital frontal cortex. So the idea, whether you're memorizing all these big terms or not, but point being is that the cerebellum is looped into these other connections. So even if you have an emotional disorder, if I'm talking about the orbital frontal cortex, you want to also think not just in terms of counseling, which is fantastic, or medications, which are often necessary, but also think about the role the cerebellum plays in emotional regulation. So meaning that there's other options or possibilities for things that may be dysregulated in other methods or other lines of treatment. So how do you treat the cerebellar disorders? That actually is the role of an occupational therapist. And so that'll kind of take me into my next concept. But again, I want to make sure I make the point here that you can do, again, I'll go back to the executive functioning. You might have some problems planning. You might have some problems thinking and decision making, getting your points across, analyzing a situation and determining what things to do in what order. And you can have these executive issues, and that might require getting some computer apps and organizational systems, or having an executive function coach. So that's one thing you can do if you have some executive function issues. Again, if you have emotional issues, there's counseling, there's medication options. You have motivational issues, there's other things to do for that in terms of developing behavior modification plans to help with motivation. You might have some sensory input issues, and that might be, super basic things like, hey, you need to go to the eye doctor, maybe get a new pair of glasses, or look at how do you perceive things, and kind of focus on perception, parietal lobe, temporal parietal lobe. But again, we don't want to ignore the role or misunderstand maybe that there's another piece here to look at, which is the cerebellum. And if there's a dysregulation there are things that can be done, again, by way of occupational therapy. Occupational therapy has people interact with the environment, interact in situations, and doing things in a repetitive way that helps strengthen the cerebellum. And interestingly enough, or importantly enough, that strengthening the cerebellum by doing physical exercises, and I'm minimizing for a second, but doing some physical interactive real world exercises strengthen the cerebellum, and therefore can strengthen all the things we just mentioned, can strengthen your emotional regulation, strengthen your executive functioning, strengthen your sensory processing and understanding and perceiving the world. So many things can get better or improve or grow or strengthen by using occupational therapy. And just to say it, that occupational therapy isn't just limited to children, although it's very important for children, particularly through their developmental process, to go through those activities and practices, but it's also important for anyone with a brain injury, traumatic brain injuries, people with other brain disorders and dementias that could very well benefit from occupational therapy. So it's another kind of avenue to go down in terms of looking for alternative therapies or other things you can do that aren't necessarily medication oriented, or if you've tried medications and they haven't been successful, there are other options in terms of what can you do. And again, particularly if the kids are going through a developmental phase, that occupational therapy could make a lot of improvements. And before I move on, I didn't want to forget that Ito had also brought up, I didn't want to miss the fact that the cerebellum's also involved in social interaction, in regulating the rate, rhythm, and force of how do you apply your social behaviors in real life scenarios. How much rate, rhythm, force do you apply to interacting and talking with people. And certainly the cerebellum is a brain region often implicated when there's autism spectrum disorders. Also implicated in schizophrenic disorders. Hallucinations can be, visual, sensory misunderstandings, and definitely, several disorders that can show up when the cerebellum is dysregulated.